Welcome to Basic Assessment with ReadySF. After we've established scene safety with the scene size up, it's time for the basic assessment. The basic assessment is our time to stop and address any immediate threats to life. Use the ABCs to remember what to check for. A, airway. Check the patient's airway. Can they talk? Is there anything in their mouth? B, breathing. Check for breathing. Are they able to breathe? C, circulation. Check for circulation and look for life-threatening bleeding. D, disability. Identify what is wrong. Ask if they're okay and look for signs of injury or medical alert tags. Let's break that down into parts. A is for airway. The first potential life threat to check for is an obstruction of the airway. Have the patient open their mouth if they're able to and spit out any food or potential obstructions. If the patient is unconscious, use a head tilt chin lift shown here to open their mouth for them. B is for breathing. Have the patient take 2 deep breaths and ask if they're having any trouble breathing. Breathing should be unlabored and easy. Patients who are having difficulty breathing, unable to catch their breath at rest, wheezing or speaking in short word clusters, or not adequately breathing in other ways, are a sign of a serious emergency. If the patient is unresponsive, watch for chest rise and fall to show that they're breathing. C is for circulation. Check for large bleeds by sweeping gloved hands under a patient's torso and checking your gloved hands for bleeding. Stop any major bleeds with direct pressure. Check for the presence of a strong pulse. For awake patients, you may check at the wrist. For unconscious patients, check the carotid artery on either side of the patient's neck. Take a moment to try and locate your own pulses right now. We'll also practice this skill in class. D is for disability. Identify what is wrong. Ask the patient what happened and if they're okay or what hurts the most. Look for obvious signs of injury, blood, burns, or major deformity from a fractured bone, for example. Look for medical alert tags, often worn at the wrist or neck. In addition to medical alert tags, cell phones may also hold clues about patients. Modern phones often include an emergency function where you can store medical information. Check for this information on the lock screen. You should be able to access it without having to unlock the patient's phone. Pause this video to take a moment to see if your phone has this function and consider adding medical information you'd want others to have in case of emergency. Those are the ABCs of our basic assessment. To review, repeat after me. A is for airway. Open the patient's mouth. B is for breathing. Have the patient take a few deep breaths. C is for circulation. Check the patient's pulse and look for bleeding. D is for disability. Identify what's wrong. Great job on your basic assessment. Next up, wounds and infections.